The person is having, whether they are in the severe criteria or mild to moderate criteria, and obviously CPAP will help you. And sometimes people are in a motion that if somebody has a sleep apnea, that is why they have become obese. It's the other way around. People are obese, that is why they are having sleep apnea. And if you give sleep apnea, they may lose 5 to 10 kgs. It will not solve their problem. It will not take care of the diabetes and hypertension. Same thing is with hypothyroid. Whenever you talk to the patient says that thyroid hai, isliye wajan badh raha hai. Nowadays it's the opposite. You are obese, that is why you are having thyroid. Once you reduce weight, the medicine stops. So this proves that it is because of obesity. And third important thing is knee joint pain. In old subset of patients, they come with knee joint pain. They are not bothered about obesity. If 1 kg of weight is increased, 4 to 6 kg of weight increases on the joint. So if you are 40 kg obese, you are 200 kg putting pressure on the joint. So it will break. You cannot do anything about it. And sometimes in our hospital, Professor Suryavan and Dr. Aditya and Dr. Kaushal Mishra are in charge of the trauma unit. They don't operate patients who are morbid obese. They ask them to reduce weight. Even when we do bariatric surgery in 3 months, they reduce 25 to 30 kgs. At that time, if the joint is still for replacement, they go for replacement. And at the end of 6 months, they have new joints and they have everything in order. Diabetes is controlled, BP is controlled. We have around 8 to 10 case series, not only from India, but abroad. We did last year one patient from San Francisco who came to Dr. Aditya for joint pain, but he refused, and this year she came, she was fine. So how do we do surgery? There are 2 major surgeries. One is sleeve gastrectomy and other one is gastric bypass. In sleeve gastrectomy, all the surgeries are done laparoscopically. So second important thing, it is not a difficult surgery for the patient. Yes, for the surgeon is different because the ports are longer, the instruments are longer, and there is a lot of torque, so it has a learning curve. It's a 5-port surgery we are doing in Primus. Even we can do a single port surgery as well in selected patients, which will be scarless. You go inside, and what we have seen in this patient, their stomach has increased in size and their intestine length is more. These are the few things which have been noticed in obese patients. So our surgery, what we are doing is we are removing the part of the stomach, and some people say it is a mutilating surgery. What are you doing? The stomach has already increased in size. It's a balloon. If you are putting more food from the beginning, it can increase in size. So some people are finished with 2 rotis, some people take 4 to 5 rotis. So why it is happening? Because stomach is different for everyone. The length is different, the width is different. So what is done after the surgery? The important thing is people think stomach cut gaya, kuch kha nahi payega. It is not like that. After the removal of the stomach, which is the standard size, it's like a collar of the sleeve. That is why known as sleeve gastrectomy. There are hormonal changes. So the important thing of bariatric surgery is hormonal changes. There is a hormone ghrelin, which is in the fundus, in the top part of the stomach, which is removed. Because of that, people don't feel hungry. After surgery, they become like a newborn baby. You have to feed them sip by sip of water, even they don't want to drink water. And because there is no storage in the stomach, the food goes in the lower intestine fast, which increases few hormones like GLP-1 and pancreatic YY, and which are hormones which help insulin. This is how diabetes is taken care of. You will be surprised, people are on 50 units of insulin, 100 units of insulin. The next day, some people may not need any insulin, and after their diet has increased, they may require a small dose of insulin. I think Dr. Shruti came to our hospital for a support group meeting. She has seen live patients who have shown their feedback after surgery. Second surgery is a gastric bypass surgery. In one surgery, we have removed our excess part of the stomach. In second surgery, the stomach is inside, but we reroute the food